Well, 3 or 4 times a year, I give out the statistics of why that I say dead doctors don't lie, so that people know why they have to take control of their own health, why they need to flee from doctors, get 5 opinions before you even consider any procedure that a doctor might lay upon you. And these are all from respectable agencies. These are not my figures. I'm just reporting the figures that are published, okay? Let's start out. Full-page article, February 5th, 2007, USA Today newspaper. This is a yearly figure. And these numbers, these numbers were taken from the Institute of Medicine, the ethics watchdog for the medical profession, the Journal of the American Medical Association, most respected medical journal certainly in America, maybe the world, and then the CDC, the Center for Disease Control, a federal agency that tracks this stuff. And they say that each year in America, this is a yearly figure, each year in America, medical doctors kill, injure, and infect 15 million Americans in their workplace. Now, this means that they kill, injure, and infect 15 million American patients in hospitals and clinics. Now, how many of you would fly commercial airlines if you knew that they killed, injured, and infected 15 million passengers every year? Nobody'd fly. So why do people keep going to doctors? You know, you get 5 bids to put a roof on your house or put a sprinkler system in your yard. When you render it down to 2 of the best contracts, you take it to the Better Business Bureau or Angie's List, okay, or Craigslist, and find out if there's any complaints about these guys before you sign the contract. You go to the same doctor for 10, 12, 15 years, 20 years, whatever they say you do. You don't even get second opinions or third opinions. I find that amazing. Well, let's kind of break it down, and let's look here. Of the 15 million killed, injured, and infected, there's 2 million infections each year in hospitals alone. 2 million infections in hospitals alone. This is because doctors don't wash their hands in between patients or after they go to the bathroom. They've been using an endoscope for 40 years. Excuse me. That has a design problem. It's been approved by the FDA for 40 years, and yet they kill people every month from residual infections, even though they clean it because there's a design problem. 2 million infections, 90,000 killed. This is yearly, a yearly figure. 2 million infections each year in hospitals alone, not clinics, just hospitals, and 90,000 killed. What would happen if North Korea or Iran were to send over an intercontinental ballistic missile with biological weapons, infect large population centers like L.A., Dallas, Texas, Chicago, places like Washington, D.C., New York, Newark, New Jersey, Philadelphia, Atlanta, infect these places with an intercontinental ballistic missile and a biological weapon and kill 90,000? It'd be war. We'd declare war on them. Well, here's one trade that does it every year in their workplace. They didn't even get an OSHA ticket. Nobody gets their license suspended for 3 seconds. Nobody gets a fine the size of a parking ticket. And certainly nobody goes to jail. And then also amongst this 15 million killed, injured, and infected, let's look at injuries here. 1.5 million American patients are killed or seriously injured by decimal point errors just from prescriptions. Okay, these are decimal point errors by the prescribing physician or fulfillment errors by the fulfilling pharmacist. Is that crazy or not? Okay, 1.5 million fatalities and injuries, serious injuries. This is a yearly figure. Another one I like is 15,000 seniors are killed each month. That's 180,000 a year by doctors putting them in the hospital. Excuse me, putting them in the hospital for minor procedures or diagnostic tests, screening tests like colonoscopic exams, X-rays, that sort of stuff, CAT scans, where they have to put dye in their veins and so on. 15,000 killed. This is from the U.S. Department of Health and Human Services Office of Inspector General. Hello, and this is because the doctors want the money. It's the only reason. These people are, these little old people love their doctors. It's a social event. They say, Granny Ruthie, you're 80 years old and you haven't been in here for a few years. I really need to do some tests on you just to make sure we catch anything in advance so we can protect you. Oh, okay, thank you, Dr. Smith. And they put her in there. They do a colonoscopic exam. They puncture her intestine and kill her, in 3 days from belly infection. They did that with Andy Rooney from 60 Minutes. Okay? They killed Dick Clark from American Bandstand by doing a prostate procedure on him that he really didn't need. They killed our top astronaut, Neil Armstrong, with a elective cardiovascular procedure he didn't need. They're all seniors, already 65. Oh, yeah. Let's see. What was her name? Doug, that comedian, 81 years old.
I can picture her face, the one that had all the plastic surgery.
Yeah. Okay, she'll come to us in a minute. They killed her. She was 81 years old, and they anesthetized her and did one of these endoscopic exams, put it down her throat, 81 years old, in a storefront clinic without any backup. Okay, they killed her, and of course she's this comedian.
Joan Rivers.
Joan Rivers, thank you. There we go.
Thank
Joan
you,
Rivers, 81 years old. They anesthetize her in a storefront clinic without backup. Hello, and everybody gets a walk. And so this is why I want you to get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. Epigenetics, The Death of the Genetic Theory of Transmission. And the whole purpose here is to learn enough to take care of yourself. Why would you want to put your hand in the people who kill, injure, and infect 15 million of their customers every year? Nobody goes to jail. Nobody gets their license suspended for 3 seconds. Nobody gets an ocean ticket. I mean, it's crazy. Okay, Epigenetics, The Death of the Genetic Theory of Disease Transmission. You'll learn how to take care of yourself, prevent diseases, reverse diseases. Why go to a doctor and get killed? You can do it yourself and live longer. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I have one here that a friend of mine passed this along to me. I have a friend who is being treated for cancer at this time, and so this is a package insert from a local pharmacy. And reading down there's all this different, what to do in case of overdose, and then there's some notes about not sharing your medication and what to do if you miss a dose, and then the bottom one is storage. They talk about how to store it in a dry place and all this stuff. Then a little farther into the storage section, it says, properly discard this product when it is expired or no longer needed. Read the medication guide for details. To discard this medication, the FDA recommends flushing down the toilet or pouring into a drain. However, consult your pharmacist or local waste disposal company. This information was last revised November 2014. And we've had plenty of stories over the year, Doc, about how they're finding pharmaceutical drugs in our lakes and in our groundwater and even in the ocean. And here we have the FDA revising these guidelines just a few months ago, less than 6 months ago, and they're still telling people to flush it down the toilet. I just can't believe it. It just was shocking when I saw that.
Yeah, and of course, most water filtration systems for small communities don't have the capacity to get all these pharmaceuticals out of the water, and they wind up in ponds and rivers and lakes, and we see so many animals out there now, hermaphrodites, where they have both male and female parts, infertility, where they're just not reproducing because there's so much birth control and hormones, female hormones and male hormones in the water. I mean, people dump their pills down there, they take it orally, and then they urinate and poop into the toilet, which goes out, has all the drugs in it, goes out into our environment, and then we drink it, next week, and we wonder why everybody's having problems. Well, this is where we want you to, again, take control of your health and use our Quanta water. Our Quanta water is a structured, really, really good-tasting water, and you can actually put it in, we have the drops that you put in tap water, and then, of course, we have the quarts of water. You can take an ounce of it and put it into bottled water, and it actually deflects the chemicals, including some pharmaceuticals, in the water, prevents them from getting into you. Precipitates them out, or I don't know all the technology, but it actually helps protect you from all these icky things in your drinking water. It's called Quanta water. It's a Youngevity product. We even have one of those CEO mega packs for Quanta water, and we're very excited about that because people use water for life. People use oxygen for life. People need the 90 essential nutrients for life, but we don't need pharmaceuticals in our drinking water. It's getting so crazy. I can't thank you enough for bringing this up. That we really, really have to do everything we can. Of course, I have so many Vietnam vets talk to me about the Agent Orange they've experienced, and they're getting so many other chemicals in the drinking water interacts with the Agent Orange stored in their body as their complaint. Well, we actually have a detoxifying product called Herbal Rainforest. It has 14 detoxifying herbs, and 78 minerals in it. You take kind of an ounce per 100 pounds of body weight. I like to take my ounce at bedtime with a glass of water. Tastes like peach juice. It's really pleasant. Kids like it. Of course, kids, you want to give them a teaspoon per 20 pounds of body weight of the herbal rainforest. It's a great way to help your body fend off all the bad stuff. If you have some of it in you, it helps you move it along. Great cleansing herbs like Cascara sagrada and Taraxacum. Well, thank you so much, Doug. Really, really great stuff, and we got to keep alerting the people here. We got to save as many as we can. Well, hang on. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
All right, let's head to Vermont. And Mary Beth, you're on with Dr. Wallach.
Hello, Mary Beth. You're on the air.
I'm calling regarding my mom, and she is currently in a nursing home for Alzheimer's, and she went in about 4 years ago at the age of 63, and she went in, and before going in, she was 180 pounds, and now she's down to 106 pounds, and she's on medication, but she's not on anything that would be considered Alzheimer's medication, so I was wondering if there were any protocols that we could use to maybe help her improve her condition.
Sure. Okay, well, first of all, there's 5 different major dementias. Vascular dementia, where the arteries in the brain are plugged. There's Korsakoff syndrome, which is a deficiency of a single vitamin. Looks a lot clinically like Alzheimer's. And then there's Wernicke-Korsakoff's, where that's deficiency of that single vitamin plus MS, multiple sclerosis mixed in with it. And then there's the deficiency of vitamin B12 dementia, and with pernicious anemia attached to it. And then, of course, there's Alzheimer's disease. Doctors always diagnose any of the dementias, and there's no rule that says you can't have all 5 or 2 or 3 or 4 of them. But they always diagnose any dementia as Alzheimer's disease because out of the code book for insurance, you get paid the most for Alzheimer's disease, so all dementias to doctors are Alzheimer's disease because that's how they get paid the most. Well, Alzheimer's disease is a going away of the white matter of the brain, the insulation material of the brain. And Alzheimer's disease is actually a physician-caused disease. Didn't occur 44 years ago. Today it's number 4 killer of adults over the age of 65. It's a very simple deficiency disease. And this is a Shar thing. Shar, here's a mom who's 106 years old. No, 106 pounds. I'm sorry, 106 pounds, not years old, 106 pounds. And she has Alzheimer's disease. And who knows how many other dementias. And so what would you do for her, 106 pounds with dementia, a.k.a. Alzheimer's disease?
I would get her on the Healthy Brain and Heart Pack, and I would get her the Ultimate Daily, and I would get her the De-Stress, and I would get her on a gluten-free diet, and she needs to eat a lot of eggs and butter.
It was perfect. Okay, as Shar said, 106 pounds, that's one of the Healthy Brain and Heart Pack. And to divide everything in half, give her half a dose of everything twice a day. The De-Stress capsules, of course, is for the Wernicke-Korsakoffs and the Korsakoff syndrome. I'd have her take 3 of those twice a day. It's 2 bottles a month. The Ultimate Daily tablets is for the vascular dementia. I'd have her take 3 of those twice a day. That's 1 bottle a month. That's designed to support and promote healthy blood flow through obstructed arteries in the brain, the eye, the heart, and the kidneys. And then also, I'd go ahead and give her De-Stress. Give her the De-Stress, 3 of those twice a day. We said that. Ultimate Dailies. Did I miss one here, Shar? Oh, the eggs. The eggs, yes. 106 pounds, I'd have her take 6 to 8 eggs a day, soft scrambled butter. Soft scrambled butter. She also needs the eggs poached with soft yolks or soft boiled with soft yolks to rebuild the myelin in the brain. Call us every couple of weeks, Mary Beth, and let us know how Mom's doing. But you're going to have to do it because usually in the nursing home they won't. Back after these messages.
Let's head to Manhattan Beach, California. And Jason, you're on with Dr. Wallach.
Hello, Jason. You're on the air.
I had a ACL reconstruction on my knee about 3 years ago.
Okay.
And still today, when I try to play sports, it gets really sore, the bones around my knee, and I can support the my joint and bone strength to build that up to my knee.
Mm-hmm. Okay, well, how much do you weigh?
135 pounds.
135 pounds. Do you have any other issues, any history of asthma, bronchitis, skin problems, eczema, dermatitis, diarrhea, constipation?
No.
Okay. That seems pretty straightforward then. Okay, Shar, this is one of your things. What would you do for a 135-pound guy who has a knee problem, had some reconstructive surgery, not a knee replacement, but reconstructive surgery on one of the ligaments back 3 years ago? What would you give him?
I'll give him a Healthy Bone and Joint Pack and get him an extra bottle of glucogel.
Okay, very good. 1 Healthy Bone and Joint Pack per month. Full dose of everything a day. And then I would get, as Shar said, an extra bottle of glucogel, so you could take 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. And all that's designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone itself. And give us a call every 2 weeks, because we actually get some pretty quick responses. We even have a history of one gal who had her meniscus surgically removed because of a car accident, and 5 years later she had another knee injury. She went to the doctor and said, "Oh, at least your meniscus is in good shape." She said, "Well, doctor, you removed it 5 years ago." He went and checked the record. Sure enough, well, even on this program, it'll regrow. So give us a call every couple of weeks and give us a progress or lack of progress report. Jason will walk you through it. Okay, Doug, we have time to start another one?
Yeah, we sure do. Let's head to Arizona. And Naomi, you're on with Dr. Wallach.
Hello, Naomi. You're on the air.
Thank you, Dr. Wallach. Thank you for being such a blessing.
Well, you're very kind, dear. How can I help you?
Yes, I actually am calling. First, I said for 2 people, but now I'm going to add myself. Let's start with my daughter. I called you about 2 weeks ago, and you told me to get us off gluten and the 10 bad foods, which I did. But we've been taking your product, the Smart, what is it? No, the Start Pack, the Healthy Start Pack, for 8 months. And I want to add that my little girl, she's 9 years old. She's diagnosed with cerebral palsy. And she used to get sick every month. The cold, runny nose and all that. She would get, I have 4 children, so she would get everyone sick. But since we've been taking the vitamins, everything, she has not been sick, even through the winter.
Okay, now let me ask you a couple of questions. How much does she weigh?
She weighed 50 pounds, but also I wanted to ask you about, she has a spastic tendon, and she tiptoes a lot. She can't even get into her braces anymore because she's forming deformalities on her feet now. That's how stiff she is.
Okay, well, we got to run one of those message moments here, Naomi, so hang on, and we'll be back and give you some advice here after these messages. Okay, Doug, we're going right back to Arizona, Naomi. Let's see here. You said you have 4 other kids?
I have 3 other kids.
3 other kids, okay. Do any of them have any problems, any skin problems, eczema, dermatitis, psoriasis, asthma, bronchitis, constipation, diarrhea, anything like that?
No, but one does have allergy, like seasonal allergies, which I've noticed the last 2 weeks that we've been off gluten. He hasn't been stuffy nose like he was before.
Okay. Okay, so yeah, how about yourself? Have you had any issues with asthma, skin problems?
I don't, but my husband does. He has eczema. He has all the allergies.
Yeah, everybody's got to get gluten-free in the household, okay? Including the dog and the cat and the bird and the fish. Everybody's got to be gluten-free. Now, Shar, what would you do for the cerebral palsy child, 9 years old, weighs 50 pounds? You appreciate that cerebral palsy is a congenital defect. Mama was missing something. Naomi was missing something in the 3rd to 7th week of pregnancy, resulted in cerebral palsy. That's not from a virus or anything like that. That's a nutritional deficiency of the embryo. All right? And to date, we don't know how to reverse it. It's preventable, but once you have it, you got it. But somebody with cerebral palsy, which is an underdevelopment of the cerebellum, they still have a heart and a liver and lungs. They still have the thinking part of the brain and so forth. They have muscles and kidneys and the liver and so on. So they still need all 90 essential nutrients. And so what would you do for this 50-pound child, Shar?
I give her a healthy brain and heart pack, but it would last her 2 months because she really only needs half a dose.
There you go. Half a dose of the healthy brain and heart pack. Exactly right. Half a dose a day. And then I'd cut that dose in half so she gets a quarter of a dose at breakfast and a quarter dose at dinner time. Because she has the sort of tendon and ligament problems, she's walking on her toes kind of stuff, her ligaments and tendons, her legs are shortening. What would you do for tendons and ligaments and cartilage, Shar?
I'd give her glucogel.
Very good. Excellent. Yeah, glucogel. I'd go ahead and get her 1 bottle a month of glucogel so she could take three or four of those twice a day. And you may have to, if she doesn't like swallowing capsules, you may open them up and dump the powder in a little, like a tablespoon of applesauce or something. And that makes a little bit of applesauce makes the medicine go down, as they say. And you could even get the cream, the CM cream. You can put that on the tendons, the Achilles tendon and so forth, which is shortened at this point, and you can put that on there and kind of relieve some of the inflammation in that tendon. And then give us a call every couple of weeks, if you would, Naomi, and let us know how this nice child is doing. We'd look forward to that. Okay, Doug, let's go to callers.
So let's head to Raytown, Missouri, and Leo, you're on with Dr. Wallach.
Hello, Leo, you're on the air.
Yes. About a year ago, we contacted an airborne virus of some type. It gave me a digestional problem. I had diarrhea for like 24/7 for 6 weeks. And I've been to 4 different doctors over the last year. And they don't understand what I'm trying to tell them when I explain it to them. It affected my brain in that I'm lightheaded or like I lost equilibrium.
Okay. Let me Okay, Leo, let me ask you a couple of questions here so I know where we're going. First of all, how old are you and how much do you weigh?
65, 149.
149 pounds, okay. And did you ever have any history of any other stuff, liver problems, heart problems? Did you ever have a diagnosis of irritable bowel syndrome or colitis or anything like that?
Barrett's condition.
I'm sorry, say again?
Barrett's condition.
Various conditions. Well, name a couple.
Barrett's. B-A-R-R-E-T-S.
Oh, Barrett's esophagitis?
Yes.
Oh, okay. That comes from reflux usually. Did you have some belching, burping, bloating?
I've been on bloating.
Okay.
Last year when I got the diarrhea, it gave me bloating.
Okay, now, wait a minute. I already got that. Did you ever have any history of skin problems, any eczema, dermatitis, or psoriasis?
No.
Okay, any asthma or bronchitis as a kid?
Bronchitis.
Bronchitis, okay. And let's see here. You weigh 149 pounds. Okay, Shar, what do you think this fellow's basic underlying problem is?
It's obviously a gluten intolerance.
Yep, got a gluten intolerance. What would you do for this guy? He's got digestive problems and reflux, and so what would you give him?
I give him the healthy digestive, 2 of them, 2 healthy digestive packs.
Yeah, 2 healthy digestion packs, perfect, because he weighs about 150 pounds. So it'd be 1 full dose of everything at breakfast, 1 full dose of everything at dinner time. And when it comes to the ultimate enzymes, I go ahead and take 1 or 2 of those, say 2 minutes before each meal with a couple ounces of water. And don't forget the probiotics, so be sure you take that. That's all part of the healthy digestion pack. But it's also imperative to stay away from the bad stuff. No fried foods, no processed meats or nitrates, nitrites. That means absolutely no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, and absolutely no oils because of the trans fatty acids, acrylamides, heterocyclic amines, terrible chemicals that cause inflammation in the body. So absolutely no oils. It means no olive oil, coconut oil, margarine, mayonnaise, cellulose, cooking oil, and no gluten, no wheat, barley, round oats. I'd also get that CD called Serial Killers and learn all of the hidden places that you're going to get a gluten, okay? Because dog food, cat food, bird food, fish food, soups, gravies, meatballs, meatloaf, it's every place. You know, things you think of like yogurt. They thicken yogurt with wheat flour. You got to read the labels very, very carefully. Okay, Doug, let's go to callers.
Let's head to Maryland, and Miriam, you're on with Dr. Wallach.
Well, Miriam, you're on the air.
Thank you. I have an 81-year-old diabetic uncle who was recently experiencing rapid weight loss. In the hospital, they found he had a shrunken liver with a massive blood vessels on it and was diagnosed with non-alcoholic cirrhosis of the liver. He continues to have rapid accumulation of fluid in the abdomen, making it difficult to eat, so he's continuing to lose weight. He's had constipation, prostate problems, and vision problems before.
So he had constipation problems, okay, and you say he had what other problems? Vision?
And vision, yes.
Prostate?
Yes.
Okay. And do you know if he had any respiratory problems or skin problems?
No. He has had spider veins, varicose veins.
Okay. All right. And what does this guy weigh now?
115.
115. And he has, you say he has type 2 diabetes?
Yes.
Okay. So here we are, Shar. Type 2 diabetes, 81 years old, has kind of a non-alcoholic liver disease. And most, 85% of the people who have liver cirrhosis don't have a history of drinking alcohol because it's caused by deficiency of minerals and vitamins. So what would you do for an 81-year-old guy, Shar, with type 2 diabetes and also liver problems?
I would give him the healthy blood sugar pack, but I'll also add the selenium to it for the liver.
Okay, very good. Yeah, I'd give him the healthy blood sugar pack. I'd get an extra bottle of the sweeties, so he can have 3 of those twice a day. And everything else, divide in half. Give him a half a dose for everything else twice a day. As you say, the selenium for the liver, I would go ahead and get him 2 bottles of that, give him 3 twice a day. And also give him the de-stress capsules, 3 of those twice a day. It's 2 bottles a month. Let's see here. And if he wants to for the vision, he can add Vision FX, 3 of those twice a day, 2 bottles a month. And for the prostate, what would you give him?
FX.
Prostate FX, very good. 3 of those twice a day, 2 bottles a month. And if constipation keeps going on, get the what for constipation?
The rainforest.
Herbal rainforest, good girl. Yeah, give him a tablespoon, half ounce of bedtime with a glass of water. Call us every couple of weeks, Miriam. Let us know how this gentleman's doing. We can help this fella out a lot. Back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Alaska. And Estrelita, you're on with Dr. Wallach.
Hello, Estrelita. How can we help you today?
Well, I'm calling back. I've been almost 2 weeks on the program now, and I had issues with hormone replacement therapy and developing symptoms of MS. And I want to report back that I had one day where I was able to walk around, and I felt like I was walking off and on normally. I am almost pain-free sleeping at night. I'm glad for that. And I wanted to ask about the hormone. Am I trying to supplant the hormones the doctor is giving me, or what am I doing? I'm
okay.
not sure.
Let's see. What are you taking?
You mean from...
Yeah, you say you're on the program. What are you taking?
Oh, what I'm taking is I've got the Healthy Brain and Heart Pack.
Okay.
Selenium, Glucogel, Ocean's Gold, Ultimate Enzymes, and I should be taking the Women's FX, but I'm
Okay,
not.
so you're having menopausal symptoms and low thyroid. Is that it?
The doctor is giving me... I was off...
Okay, and that's not exactly what I'm asking you.
Oh,
what I'm
okay.
asking you is, did you have health problems with your thyroid gland, and you're going through menopause, so you put you on, women's hormones, or what?
Well, I was, no, as a result of a total hysterectomy.
Okay, so you had surgical menopause.
Mm-hmm. Yeah, and I had to seek out a doctor who would give me, compounded hormones, and then I lost that doctor, so I was for a year without hormones.
Okay, how much do you weigh?
135.
Okay, 135 pounds. Okay. Yeah, the goal here is to give your body what it needs so that you're not having to take the hormones anymore, right? Or the thyroid medicine, which is kind of a fake synthetic hormone, okay? Synthroid, U.S. Armour Thyroid, levothyroxine, those kind of things. So, Shar, what would you give somebody who's 135 pounds, has low thyroid problems, and a surgically induced menopause? What would you give her?
I give him Ocean's Gold, but I think she's taken that, and I would also give her the Woman's FX.
Okay, and we have a new product to add to that. What would you give?
Oh, Xerafem.
Xerafem, Xerafem, and all that, Estrelita, which is the Ocean's Gold. That's for the thyroid. Your body weight, I'd go ahead and give you 3 of those tablets twice a day. That's 2 bottles a month. The Woman's FX, I'd give you an ounce twice a day. That's 2 bottles a month because it's a quart, so it'd be an ounce twice a day. And the Xerafem, I'd go ahead and take 2 of those twice a day. That's 1 bottle a month. And then, of course, the basic program at 135 pounds would be 1 Healthy Brain and Heart Pack, as Shar says. Okay, and it's imperative you stay away from the bad stuff. That would include fried foods, processed meats, oils, and gluten. And the story is this. Your goal, of course, and you want to get a hold of that trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, and the Passport to Aromatherapy, and learn how to do your own, for instance, your own thyroid test. It's a basal body temperature test. It's in the home laboratory test. As your body temperature creeps up to the normal level in an underarm test, it's called the basal body temperature. A lot of women use that to see when they're ovulating to, kind of increase the rate of pregnancy because they want to have sex where they're ovulating. and so forth. And you can use that same principle to say, okay, I can begin to reduce my prescription drug here for thyroid. Also, after about a month or two on this program, you should be able to begin to slowly reduce the compounded hormones you're on, and so you won't need them. Okay? That's the goal here. Give us a call every couple of weeks. Let us know how you're doing. Now, Doug, how much time we got here?
We got about 15 seconds.
15 seconds. Well, I'm going to go ahead and take it and remind everybody about my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. Make sure that you get this book, because it will add 25 to 50 healthy years to your life, because it teaches you all the diseases that are said to be genetically transmitted in humans are not, including type 2 diabetes. We've known for 70 years that this is a simple mineral deficiency. You take the 90 essential nutrients plus a little bit of extra of that mineral, and you have the possibility of getting rid of your type 2 diabetes in less than 2 months. Well, I'll have to ask my doctor. Don't do that. He won't believe it. Okay? So give us a call every couple of weeks. Call your Youngevity associate today. Get the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. Join me. Be one of my 1,000 people that live to be 200. I know Char's coming along with me. I know Doug is and Billy is. Why don't you come along with us, too? Well, thank you, Char. Super job. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.